Greetings, everyone. This is Mark Skidmore. I'm the Director of the Regional Center for North Central Regional Center for Rural Development. Thank you for being here on today's webinar. This webinar is also being recorded for those who would like to view it later on. This is sort of our kickoff for the fall, and you can see here that today's first webinar is the North Central Region Aging Network, a multi-state collaboration to enhance aging-related extension outreach. And I'll talk a little bit more about that in just a moment. But keep in mind that in the month of September we have two other upcoming webinars, one on September 12th and the other on September 25th. So that's what you see on your screen there. Okay, we can go ahead and put the PowerPoint on for the speakers today. And so today we have Dr. Erin Yelland, who's an assistant professor and extension specialist in the College of Health and Human Sciences at Kansas State University. James Bates, an associate professor and field specialist of family wellness at Ohio State University Extension. And we have Dr. Jacqueline Benson, an assistant professor of human development and family science and state specialist in gerontology for the College of Human Environmental Sciences and Cooperative Extension at the University of Missouri. That was a mouthful. So thank you,
All right.
Aaron, Jim, and Jackie for being here. I think this is a very timely and important topic. As we know, all around the country we're getting older, but in some places in our region we're getting older very rapidly. And so I think this is an important topic and look forward to your talk. For those on watching, if you have some questions or would like to make a comment, you can do so in the webinar chat down below. You should be able to see that, and the speakers can respond to that either along the way or at the end, whichever you like. And so with that introduction, I'll pass it on to the speakers. Thank you again.
All right, fantastic.
Great, thanks. No. Jim, are you going to start us off, or would you like me to go? I think you're...
But go ahead.
Okay. There we go. Okay, Jim's muted now. So welcome, everyone. I'm Dr. Erin Yelland from Kansas State University, and I'm going to be kicking us off here. And the fun part of technology is that we all get to connect from all across the country, and you'll see that, or you'll hear that Jackie and I are joining today from two different universities, and Jim is out in the field joining us from remotely. So we're very excited to have this experience and opportunity to be able to share what the North Central Region Aging Network is doing. And we're happy to be able to connect with everyone today. So a little bit about the North Central Region Aging Network. We are a collaborative of extension professionals that are really interested and passionate about aging-related topics. And as it says on the screen, we're also dedicated to improving the health and well-being of adults in later life through science-based strategies. And a little bit of how we got together. So back in 2016, the Family and Consumer Sciences program leaders from across the North Central region brought together all of the specialists for a meeting in Chicago, Illinois. And at that meeting, we were going around the room introducing ourselves and talking about our areas of expertise. And of course, we had a lot of people who were naturally interested in nutrition and physical activity and these sorts of things. But there was a handful of us who said that we were really interested in aging, and that was the work that we were pursuing through Extension. And what was fascinating is that most of us didn't even know that the rest of us existed. We really didn't have these pre-existing relationships and networks. Many of us were also early in our careers, so there was part of that going along as well. But at this meeting in 2016, we were able to finally identify one another and be able to start talking about how we can work together across the region to enhance the aging-related work that Cooperative Extension is engaged in, not only across the region, but also within the country. So you'll see on this slide, here are our members, and we actually have representation from 11 of the 12 states in the North Central region. And you'll notice that Nebraska is missing, and that's basically because they don't have a position of on campus of someone who's working directly on aging-related issues, but we do keep them informed. So just know that we do have representation from 11 of the 12 states within the North Central region on our team, and 2 folks from Iowa State, I believe. So we are just really privileged to be able to work with one another. And if you're housed within the North Central region, and I'm sure you know one of these wonderful people that works on campus or out in your communities, be sure that you connect with them and ask more about the work that the North Central Region Aging Network is doing. So we're always happy to share and talk about the work that we're doing and hear other people's ideas as well. So we have some basic priorities through the North Central Region Aging Network, and generally it's our main goal is to increase the number of adults who are healthy in later life. And of course we do this through a variety of modalities and interventions and programs and resources and all these sorts of things. But we really want to focus on creating those healthy choices in safe environments, and also looking into what extension priorities we can help to promote and encourage across the system. And so you'll see on our graphic here on the slide that we have some priority areas such as aging-friendly communities, healthy aging in general, brain health, caregiving, whether that's formal or informal, talking about age-friendly homes, ranches, and farms, so really trying to pull in that rural aspect of being able to age well. End-of-life planning, whether that's financial or getting your medical advanced directives in place, those sorts of topics. Finances is a huge one, and then a whole variety of family-related topics as well. So these are the extension priority areas that the North Central Region Aging Network is really focusing on. But in general, and you'll see on the right-hand side here, that our primary goal is to promote, support, and encourage activities that strengthen and advance evidence-informed extension practice in aging-related issues. And we've been able to accomplish those goals, and we're continuing to work on those goals in a variety of ways. So some of what we have already completed as a network, one of our first big notable activities was a regional needs assessment. And so many of you might have actually completed this needs assessment. We sent it out to all extension professionals across the North Central region, regardless of your area of focus. So whether you were in 4-H or ag or community development or in extension administration, we wanted to hear from you of what the aging-related priorities are that you are seeing in your communities, and what are the big aging-related needs. And if you participated in that survey, thank you so much. We received over 1,100 responses to that survey from across the North Central region, which we thought was incredibly impressive, and we were very proud of that work. We have a fact sheet that's on our website, and our website is ncran.org, where you can learn more about the results from that survey. And we actually just had a Journal of Extension article accepted a couple of days ago. So you'll be seeing more about our regional needs assessment coming out in JOE in the next couple of months. The second major initiative that we wanted to undertake was developing a toolkit of aging-related resources. And so this toolkit then ended up becoming our website. So originally, at this initial meeting in 2016, we said that we each have so many resources, but no one's really communicating about them. Or Missouri can have a resource that we don't have here in Kansas, and being able to share those resources obviously benefits the constituents of Extension, far more than had we not collaborated and shared those resources. And that's really the land-grant mission, right? So we wanted to figure out how we could create this toolkit of aging-related programs so that we're not constantly reinventing the wheel per se. And like I said, that ended up becoming our website. So in our website, which again is ncran.org, you will see on there a whole host of aging-related programs that have been developed across the North Central region and outside of the region as well on a variety of topics. So mainly, you'll see a lot of the topics that I mentioned earlier in our extension priorities. You'll see a whole host of programs that sort of cover those topic areas. With that, we also identified a need for extension professionals to receive some professional development on both aging-related topics, but just extension professional development in general. And so we have been offering for about a year now, I believe, twice monthly webinars on Friday mornings. In the first Friday of the month, we have our Gerontology 101 series. And here we have presenters from all across the country come in and talk about any sort of aging-related topic. Then on the third Friday of the month, we have been discussing extension professional development in general. So whether that's talking about recruiting new audiences or how to do simple analysis in Excel of some of your evaluation information. We've also recently had one on the benefit of doing international experiences to enhance extension professional development. So through these webinars, we've been able to cover a whole variety of topics. They are generally presented live. Some of them are recorded, but all of them have been recorded and archived and are available on our website, which again is ncran.org. With that, we've also had several blogs as well. So blogs on a whole variety of topics, just short, easy reads. And really the goal of those is to be able to have extension professionals take them and be able to use them in whether news releases or other social media things and stuff like that. So those are some of the notable initiatives, and I'm going to pass it off to Jim next, and he's going to be sharing more about what we've done in these three specific areas.
All right. Hey, thanks, everybody. Thanks, Erin. I'm going to talk a little bit about the needs assessment and what we found and run through this fairly quickly. As Erin mentioned, we sent out a Hardy survey to the North Central region. This went to administrators, it went to educators, agents, it went to staff, and to try to figure out what are the needs that that extension is experiencing, and with the finger on the pulse that we have in our communities, in our counties, to find out what in terms of aging do we need to address, and what are those identified needs and opportunities for us in education and in outreach. We asked about current needs, future needs, and materials needed. And I'll just highlight these briefly here. Essentially, the current needs and the future needs were the same: access, availability, and affordability of health care. That was just front and center in our communities. In terms of materials needed, there was a need for to think about nutrition and food safety for older adults and for that population. There are certainly developmental needs related to food and nutrition as we age, different from those nutritional needs when we're younger. So it's no surprise that came up here. In terms of current needs, the second most critical need was focused on chronic disease prevention and management. So helping folks think about, how do I take care of myself now? What are the resources available to older adults now, so that the chronic disease or the comorbidity doesn't become a problem or as much of a problem later in life? And how do I manage the challenges that I have right now? And so in terms of future needs, access to affordable and safe housing is something that came up. And certainly a state by state and county by county, community by community type of an issue. But I think when we think of the North Central region, we think of rural, and what are the needs of our rural population, as well as certainly the urban population in terms of housing that's safe and affordable for older adults. Thinking about also our current future needs, the number 3 slot there is transportation, and being able to still participate in community life, but have the means to get around to do that. So whether that's public transportation or family who's available to drive the older adult around, so that they can still participate and live independently as possible, but still participate in community life. In addition, asking about specifics about programming, we found that nutrition and physical activity, as Aaron mentioned before, were the most valuable aging-related programs that we currently offer in the region. We also want to highlight certainly the falls prevention, brain health, farm succession, and
up where Jim left off, and with those most valuable aging-related programs, again, he was mentioning farm succession and diabetes prevention and management. So with this, we really asked extension professionals who were already delivering aging-related programs what they perceived to be the most valuable and what they felt like had the most impact. Then we also wanted to know preferred educational delivery methods by extension professionals. So one thing that we know in extension is that things are changing, and going out and doing face-to-face meetings doesn't always work as well as it once did. So we wanted to see what extension professionals' opinions were on that. Still, though, the most valued or preferred were those in-person programs. And we had a lot of agents report, and we all hear anecdotally, that when you can make those personal connections, that can oftentimes have the most meaningful results. They also preferred fact sheet publications, so still having that written material that they can give out to individuals when they have someone come into the office, or someone who asks a question and they're just able to give them that fact sheet of information to be able to help that individual learn a certain topic or be able to improve their life in some way. And then the third most preferred was online resources. So personally, I found this a little bit surprising because we see so much desire for technology, but still our extension professionals are saying that in-person programs and these fact sheet publications, more of the traditional methods, are still what they're generally preferring for receiving new and additional resources. So as I mentioned before, our website, I've mentioned this numerous times now, but ncran.org, and here you can see again some of those priority areas that we have identified. So aging-friendly communities and homes, caregiving, cognitive and emotional health. And here that's been a really big one recently, talking about with the opioid crisis and stress management, and particularly rural stress management as well. So we have some good resources there. End-of-life issues, exploitation and protection is always a big one, talking about frauds and scams and elder abuse and neglect. Finances, health promotion, and health promotion is really, again, looking at chronic disease prevention and management, as well as some of those other healthy living topics. physical activity and nutrition, and then, of course, relationships. And we always like to reiterate that relationships are always important no matter your age, and continuing to being able to talk about healthy relationships as we age is really beneficial for individuals. And earlier I was mentioning our webinars, so here's a little bit more information about them. So the first and third Fridays through this year. Next year our schedule is going to look a little different, but those are offered at 11 o'clock Eastern, 10 o'clock Central, with the first Friday of the month being our Gerontology 101 series, and the third Friday of the month being our Professional Development series. And you can see an example of our archived webinars on the right-hand side. And this was a webinar that I presented with some colleagues last month on international professional development and how it can enhance extension, outreach, and impact. And I'll just put in a plug for that. We did a study abroad tour to one of the blue zones or aging hotspots in the world in Greece this summer with extension professionals from Kansas State University and the University of Kentucky. So if that's a topic that you're interested in and learning more about international professional development, that was one of the webinars that NCRAN was able to offer. And I mentioned earlier also our blog. And so here's an example of a blog that we have from Dr. Kristen Litzelman from the University of Wisconsin, where she gave some really good resources and tips on, is your community a good place to grow up and grow old? And Kristen is one of our members who has a lot of expertise in creating aging-friendly communities. So you'll see across the NCRAN website that we have a whole host of experts on a variety of topics, and that has really helped us to become a very effective network in our opinion. And we have been able to reach a whole lot of extension professionals and have received a lot of really great feedback on our network and the resources that we're able to provide. So next up, we will pass it off to Jackie, and hopefully she will be able to connect with us here. And she's going to be talking about our successes and how NCRAN perceives, or what we perceive to be some of the main points that have led us to be so successful as a network.
Thanks, Erin. Yes, so as Erin and Jim just laid out some specific projects that we've done as a group, and we hope that what we've been able to share with you is really convey that we've been successful in that, in accomplishing those projects, visualizing them, and implementing them. So we recently took a step back, just zooming out to assess what we've been doing the last couple of years and figure out what is it that makes our group tick so well. We have all been a part of other multi-state, regional, national collaboratives that work to varying degrees, but one thing that we agree on is that for all of us in the group, this has been one of the more successful groups that we've been able to participate in. So we did just some brainstorming together, wanting to figure out what are kind of the major themes that contribute to our success. So here I've listed these 4 ideas that we think have a lot to do with answering that question as to what makes our group work together so well. And I'll talk about each of these separately. But the first one is visioning, shared leadership, connection, and data-driven decision-making. And I'll talk about each of those. So beginning with visioning. In March of 2018, we decided, and we had met, of course, the year prior, as Erin had described, when we first convened as a group, and so much of us coming together was just quite serendipitous. We came to these meetings in Chicago and really didn't have necessarily a goal of what we wanted from those visits. It was just an opportunity to get to know other people, like-minded folks, who hopefully had a shared interest in gerontology, and we found our group. And we put together some goals at that meeting of what we wanted to do in terms of small projects, and that's where the needs assessment was born. But when we finished that project, we decided, okay, how do we keep us going? Sustainability is really important. We really enjoyed working with one another, so we needed to come together again and figure out what would be our vision. So that's what happened in March 2018. We held this multi-day retreat to give us the opportunity for some visioning and planning in that regard, developing a strategic plan. And we broke that down into looking at some of the short-term goals, which really centered around some of the projects that Aaron and Jim talked about that we've completed, but also what we wanted to do in terms of thinking into the future. It also included putting together our mission and our mission statement, putting together goals, objectives, outcomes. So as we mentioned on that previous slide, that long-term impact and sustainability of the group was guided by our mission, and that's what we came together in March to put together. It's promoting, supporting, and encouraging activities that strengthen and advance evidence-informed practice on aging-related issues within Extension. This time together that we had in March was really crucial to several things here. Establishing a group identity, creating bylaws was another output of that project, or of that time that we came together to meet and do some visioning. We put together an ad hoc committee to develop those bylaws for the group. Decide how leadership, how it would take form, how we'd rotate that, which I'll talk about in a minute. It also gave us an opportunity to just foster solidarity between group members, and I'll talk about that a little bit more when I talk about connection. And then the process of visioning and the resulting consequence of creating a mission statement, the goals, the objectives, outcomes, they all served as motivators and justification for the projects that we've developed then or brainstormed about then and continue to do so now as we meet on a regular basis. The second key to success is this idea of shared leadership. And I think we talk about this when we talk about working in groups a lot, but what does this really mean? And that's something, Aaron and Jim and I spent some time talking about too, just the three of us. Like what does that mean in more tangible sense to engage in a group where leadership is really shared? So on a formal level, it certainly meant this idea, and this was written into our bylaws, of course, is having these rotating co-chairs, and then also standing committees for leaders. And as I mentioned earlier, we have some ad hoc committees that come up, of course, like in any group, as needed. But everyone had a seat at the table on committees that they are interested in, doing work that they're most interested in. And then everyone also has an opportunity, if they would like, to get to chair and co-chair. And I also think that not just having a single chair, but the co-chair, not having two individuals lead together is really effective in this group, or it has been so far. It allows the burden of managing the group and preparing for our monthly calls to not fall on one person, and it also gives the rest of the group two different people to go to for different concerns or questions, so that it's not just one leader of the group for the full term. And then we do have, with that rotation, as one chair is leaving, we bring in the other one to work so that there's always an overlap between chairs. It's not a whole new set or new pair of co-chairs each time we rotate. In terms of informal leadership, and I think this is really key to explaining where shared leadership comes in for our group and what that means, is that we respect each member as a peer and an expert in their own right. So, leadership is shared in the way that we interact with one another. It's that having that respect for each other about what we are particularly knowledgeable in, whether that's content areas or methodologies. And although the network, it consists of members with this shared interest in gerontology, right? That's how we all came together. Our specific areas of expertise vary widely, and as do our positions as faculty, as community educators, as researchers are in our institutions. We all have different FTEs dedicated to extensions. There's a lot of variability, and sometimes that can be a recipe for disaster with groups when everyone has so many different expectations in their home institutions. It's really hard to stay motivated and active in these groups that we really are voluntarily a part of, or many of us at least are. So A big part of creating that sense of solidarity is the fact that we spend time together to learn about each other's strengths, and then, of course, the result of that is being able to gain that respect for one another and lean on one another for our varied expertise. Also, recognizing the value of this diversity early in our group's formation was really key, something I forgot to mention. Like establishing a sense of interdependence among members is a big result of that. So, of course, as I mentioned, we met in March, but it was fantastic that when we did initially meet each other, we were not only thrown together, having really no knowledge of one another previously or even who was going to be there, we were thrown together and we spent almost 2 full days with one another. And I think that was really key to keeping us moving forward as a group, rather than if we would have just decided to put together a 1-hour conference call of interested parties to see what we could come up with. Not a lot can be discussed in that 1 hour, right? And so often we don't kind of continue the momentum. But we had spent so much intensive time with one another that it was hard to walk away and not be dedicated as a group. And also with that, favoring teamwork in our visioning process is a big part of that. When we met together as a team in March and talked about the short-term long goals we wanted to put together and this whole idea of visioning, it really centered around this idea of teamwork and wanting to make sure that we had this sense of shared leadership and we didn't work in any single silos on projects. We included one another. We do that over the phone. We do that over email. And so there's just this great sense of collaboration and truly just friendship amongst one another. And our efforts to accomplish project outcomes, and our efforts to accomplish those outcomes is also really centered around that sense of teamwork. So consequently, our shared leadership group dynamics, they're just internally motivating the group members to be accountable, to be supportive of one another, and share that responsibility for the group's success. In terms of connection, and I think I've probably already in many ways conveyed that we developed a sense of connection, and in so many ways that came about kind of serendipitously as well, right? But we've also, in recognizing that we were able to form that early on, have made efforts to keep that going. And a big part of that is being dedicated to connecting as a group on a monthly basis in real time. So we're not face-to-face in the same place, but we're able to see each other face-to-face using Zoom or is what we use, but any kind of live video conferencing technology will do. And then we, again, try to make sure that we intermittently can meet face-to-face. There's just, you just can't really replace that, the benefits of face-to-face interaction, just like Erin was mentioning earlier with our extension educators out in the field and what kind of programming they like to receive. It has a lot of what their interests center around is programming that allows them to do in-person meetings with their community members, and we value that as well, just working together as professionals. When we do meet face-to-face or via live video conferencing, we spend that time in several areas, do a lot of brainstorming, project work, of course, discussion of issues, but we put together, the co-chairs, whoever they are at the time, put together an agenda for that. We've most recently developed a more time for community of practice at the end of our calls, and we still use the email listserv for idea sharing. A lot of it is just informing one another of different professional development activities that are available to one another or that we can alert our county educators to or regional specialists about, and also just kind of perspectives on current events if we want to get involved in making a statement about aging programming and funding and how administration should be funding aging services in our nation. Someone will hear about that, put it on the listserv, and we'll get together and quickly put together a statement that we can submit on behalf of NCRAN. Okay, and then the last key to success I want to mention is this idea of data-driven decision-making. Members' appreciation for this theme, this data-driven decision-making, is a huge feature to our success because with so much variation among members' expertise, brainstorming sessions undoubtedly yield a fruitful list of options, exciting ideas for projects, right? Of course. We're coming from for all different departments. Our roles in our departments or at our universities are quite varied. Some of us interact directly with community members and older adults and their families on a day-to-day basis out in the field all the time. Others have spend more time on campus, engaged in research and interacting and providing service to aging families in that way. So we come up with a ton of ideas. It's one of the most fun parts of that about being a part of this group is the ideas we can come up with. But how do we decide which ones we're going to select and move forward on? And that's where it's really key, and we're all very dedicated to making sure that we lift up those ideas that are really backed by data, right? That we think there's empirical data that we can use to help us make those informed decisions about ideas that, whether we should discard because there's not a lot of evidence to support that program per se. Should we halt this for now because there isn't funding available perhaps? Or prioritize, we make those decisions based on data, and it's really crucial to team stability and honoring NCRAN's vision. So just as final thought, as was initially described when NCRAN came together, it was, as I've said, very serendipitous or coincidental. So it started with passion and that coincidence, and it developed once we recognized that we all had that passion. We knew that wasn't going to keep us going, though. We couldn't just thrive on that alone. So we had to focus on developing a vision and focus on sustainability, and that's really what's contributed to our success. So before I open it up to any questions for us, I just want to thank NCR CRD for hosting this webinar, for supporting us in some of our projects, funding and otherwise. We appreciate you all so much. And right now, I'll leave it open it up to questions.
Okay, thank you, Jackie, Aaron, and Jim. We really appreciate all this work and all the information that you are making available to all of us. I think if there are any questions, they can type it in the chat, but just to get things rolling a little bit, perhaps there'll be a question. But I wanted to ask a couple of things. The first is just in the chronic health arena, diabetes the rate of diabetes among the aged is growing. Right now, among 65-year-olds and older, about 25% have diabetes, and it's expected that could increase, could double in the next 20 or 25 years. Did that come up as an important issue in some of the work and the survey stuff that you did?
Well, I will go ahead and answer that question for you. And I think, so chronic disease prevention and management came up a lot, and whether that's referring to a whole variety of chronic diseases, diabetes being one of them, but that is something that we have discussed as a group because there are some diabetes management programs. So currently across the North Central region, we have a group working on the Dining with Diabetes program. And so we're able to connect extension educators to that program. And then there's also the diabetes prevention program that is, I know in Kansas that's offered through our state office of, or our Kansas Department of Health and Environment. So we have those connections, and we're able to connect people to those two specific resources. And again, both of which are being presented through Extension across the country in a variety of ways. But yes, diabetes is certainly a huge issue. And one of the things that, we can note about NCRAN is that we have a variety of expertise, but we don't have someone who is who has a background in nutrition on our team. But because even though we don't, because we have such a broad network across our states, we're still able to connect people to nutritionists and our other nutrition faculty who have those sorts of nutrition-related expertise and ability to answer those questions. So that's another beauty of our network, is that we are so large, so we're able to still connect with other people. But yes, diabetes is certainly one of those big issues, and we're hoping to still be able to connect people with those resources.
Good, thanks. The other question that I had was just sort of thinking about sort of broader policy questions. When I think about, especially in our region with communities that are aging and population is flat or declining, and we do have this immigration policy intention, and yet birth rates alone may not be sufficient to kind of keep our economy and our just everything about our country moving. And so the inflow of people is really important. I'm wondering if you can comment on this idea of aging and the need for immigration potentially, or the challenges and trade-offs between those two questions. As we age, do we need to increase immigration? Is that a tension in communities, that kind of thing?
So I'll just briefly comment on that because it's a quick response. We didn't investigate that subject specifically in the survey. And Aaron, correct me if I'm wrong, but I don't think that there was great opportunity for folks to explore ideas other than selecting other. But I mean, there wasn't, we didn't do focus groups, and I think that would be a perfect topic to address in a more focused way, with some qualitative interviewing through focus groups or whatnot, to investigate what the response would be regarding immigration and how people see that impacting aging families and older adults in our various communities.
Yeah. Okay. Thanks. I know it's not directly connected, but certainly related, because many of the communities, may experience tension with immigration, but it might be actually a topic to bring people together, in some of the communities as they recognize that they're aging and getting older, and what does immigration mean for them, in both positive and potentially negative.
Mark, I'll just comment briefly. The network members have from day one, or maybe day two, have highlighted this idea of ageism and the need to educate people on what ageism is. And I think no better place do we see that than in the workplace, where people are being excluded from the workforce because of their age, or because the perception is that they can't work, or they don't have the ability to do something that someone else can do. And so just that tension between, well, maybe these older adults, maybe we need to give them a chance so they can participate in the workforce for a longer period of time, and then the question of immigration and whatnot. If that's a workforce replacement issue, I think that there's a couple of different tracks and ideas, policy that could begin to address that. And I think starting domestically with this idea of welcoming older adults to the workplace and valuing their contributions, their knowledge, and their expertise that they've developed over a lifetime of employment.
That's a good comment. Thanks. That's a good comment. Thanks.
And Mark, I have something to add to that. So this summer, I was in Washington, D.C. for NELD, which is the North Central Extension Leadership Development Program. And I had the opportunity to go to the National Immigration Forum when I was there in D.C. And actually, I got into a really lively discussion with one of their, I think he was their vice president or one of their senior administrators, regardless, because they are really starting to look into the impact that immigration can have on the workforce that is helping to ensure that older adults are able to age in place, but also receive the health care that they need. So their research has found that a lot of care providers, whether it's in long-term care facilities or home health aides and those types of positions, have been filled by immigrants. And what do the immigration policies that may or may not be coming down the line, what sort of implications does that have for the healthcare workforce? And then ultimately, what type of implication does that have for the aging population? So I think there's some interesting things going on that I know, across the network have been exposed to this type of information. We're sort of keeping an eye on it. But I think it's a really interesting topic. And when we're thinking too about our communities and how they're aging so quickly, and in Kansas we have communities that are completely dying off because the people that are there are dying and the young people have left. So how can we, think about immigration as a way to also keep our communities thriving and workforces going and things like that? So it's a really interesting topic.
Well, thank you. Thanks to all three of you for sharing and doing this work and giving the presentation. I've also been thinking a little bit in terms of shrinking communities and how do you maintain an adequate level of public services and quality of life when your economic base and your property tax base is declining, and younger people may be moving to more urban places, and then those who stay in the community are older, and so it's a challenge that way. So I've been thinking about that as well. At any rate, I think maybe we're just about out of time, and again, I want to thank you for your work here and for giving a great presentation.
Thank you for your support, Mark. We appreciate it very much.
Oh, really glad to
Thank you,
do
Mark.
that. Okay, we'll sign off for now then. Thanks.
Take care.
Thank you.
Bye.